The harsh fluorescent lights of Metropolitan General's conference room cast unflattering shadows across my parents' faces as they reviewed my proposal. My father's reading glasses perched on his nose as he flipped through the meticulously prepared documents, while my mother's perfectly manicured nails drummed impatiently on the mahogany table. Dr. Elizabeth Carter, my father read aloud, his tone dripping with disapproval. Requesting to buy into Carter family practice. He looked up, sharing a knowing glance with my mother. Your timing is interesting considering your current position. I remained silent, watching them dismiss 3 years of careful planning with each condescending page turn. To them, I was still the disappointment. The daughter who chose emergency medicine over their prestigious private practice, who worked nights in the common hospital while they treated Manhattan's elite. Really, Elizabeth, my mother sighed, pushing the proposal away. A resident's salary? You can't possibly think you can afford this. I've saved carefully, I replied, keeping my voice neutral. And my work in emergency medicine has given me valuable experience. Experience? My father scoffed. Racing around the ER like a common medical worker? Our clients expect sophistication, prestige. They want the Carter name to mean something. Little did they know how much the Carter name would mean after tomorrow's board meeting. I've built a solid patient base, I continued. My emergency department satisfaction rates are the highest in the emergency department, my mother interrupted, adjusting her Hermes scarf. Where you treat anyone who walks in. She said it like it was a personal insult to our family's medical legacy. My phone buzzed quietly, likely another update from my lawyers about tomorrow's announcement. I ignored it, focusing on the meeting I knew would end exactly as I'd planned. You can't afford to buy into our practice, Dad declared finally, closing the folder with a decisive snap. Not now, not with your current status. Perhaps in a few years if you reconsider your career choices. You mean if I abandon emergency medicine? I asked quietly. If you start practicing real medicine, he corrected. Private practice, Elizabeth. Selective clientele. Building relationships with people who matter. I thought of the contracts sitting in my private office upstairs, the one they didn't know existed. The board meeting tomorrow would certainly be about relationships with people who matter, just not the way they imagined. We're doing you a favor, Mom added, her voice softening with fake concern. The buy-in alone would bankrupt you. And our patients, well, they expect a certain standard. Your emergency room stories about gunshot wounds and overdoses would hardly impress Mrs. Astor during her Botox consultation. My phone buzzed again. This time I glanced at it briefly. A message from the hospital board secretary confirming tomorrow's 9 a.m. meeting. I understand, I said, gathering my proposal. Thank you for your time. That's it. Dad looked surprised at my lack of argument. No debate? No pleading? No, I smiled slightly. I think tomorrow will bring enough changes without any debate today. Finally learning your place? Mom asked, pleased at what she mistook for resignation. Something like that. I stood, straightening my white coat. I should get back to my shift. Those common emergency patients won't treat themselves. As I walked to the door, Dad called after me. Elizabeth? We expect you at the hospital board meeting tomorrow. As part of the Carter family, you should at least show face when they renew our privileges. Oh, I'll be there, I assured him, thinking of the sealed envelope in my office upstairs. I wouldn't miss it for the world. The Metropolitan General Hospital boardroom buzzed with quiet conversation as board members and department heads filed in for the 9 a.m. meeting. My parents sat near the front as they had for 20 years, their matching white coats pristine and name tags gleaming. I chose a seat at the back, watching them network with their usual crowd, plastic surgeons, private practice owners, the kind of doctors who saw medicine as a business first and a calling second. This meeting of the Metropolitan General Hospital Board will now come to order, Dr. Williams, the aging board chairman, announced. Before we begin our regular agenda, we have an important announcement. My parents straightened in their seats, likely expecting their annual privileges renewal to be fast-tracked as usual. As you know, Metropolitan General was recently acquired by Summit Healthcare Group, Dr. Williams continued. Today, we're honored to introduce our new Chief of Medicine, who will also serve as CEO of Summit's entire East Coast division. Murmurs rippled through the room. This was news to most, except me. Dr. Elizabeth Carter, would you please step forward? The silence that followed was deafening. My heels clicked against the hardwood floor as I walked to the podium, enjoying the way my parents' faces drained of color. Elizabeth. My father's voice cracked. There must be some mistake. No mistake, Dr. Carter, I replied formally, taking my place at the front. Summit Healthcare Group acquired Metropolitan General 3 months ago through a series of private equity deals. Deals that I orchestrated. Impossible, my mother whispered. You're just a resident. A resident who spent 3 years building a healthcare investment firm while working emergency medicine, I corrected, opening my laptop. Summit Healthcare is my company. I own 67% of Metropolitan General and 5 other hospitals across the East Coast. The screen behind me filled with financial data, acquisition details, and my official appointment as Chief of Medicine. My parents stared at the numbers, billions in assets, thousands of employees, and their daughter's name at the top of every document. Now, I continued, let's discuss some changes. First, the hospital's mission statement. We're expanding our emergency services, doubling our trauma center capacity, and implementing a new community health initiative. But our practice, my father stammered. Our privileges. About that. I pulled up another document. As Chief of Medicine, I'm reviewing all private practice privileges. Those who don't meet our new standards, including minimum hours of emergency room coverage and community clinic service, will have their privileges revoked. You can't do this, my mother stood up, her voice shaking. We built our reputation here. A reputation for choosing wealthy patients over critical care, I replied calmly. That ends today. Metropolitan General will serve everyone, not just those who can afford boutique medical services. The board won't stand for this, my father declared, looking around for support. But the other board members sat silent, many nodding in agreement with my words. The board already voted, I informed them, displaying the results. Unanimously. Your privileges are suspended pending review. You have until the end of the month to either meet our new requirements or find another hospital. We're your parents, my mother hissed. Yes, and you taught me well, I smiled. About business, about medicine, about power. I just chose to use those lessons differently than you expected. 1 month later, I stood in Metropolitan General's newly renovated emergency department, watching the controlled chaos of a Level 1 trauma center in action. The expansion was nearly complete. Double the beds, state-of-the-art equipment, and a staff that finally had the resources they deserved. Dr. Carter? My assistant appeared at my side. Your parents are here for their meeting. I nodded, checking the time. Send them to my office in 5 minutes. I need to finish something first. I walked to Trauma Bay 1, where a young resident was treating a homeless man with infected wounds. The same patient my parents would have turned away a month ago. Good work, Dr. Chin, I said, reviewing her treatment plan. Make sure he's connected with our new outreach program before discharge. Yes, Chief, she smiled, clearly still amazed that the Chief of Medicine regularly worked your shifts. In my office, formerly my father's, I waited as my parents were shown in. They looked different now, humbled, tired, maybe even a little scared. Elizabeth, my father began, we've reviewed your requirements. And I kept my voice professional, gesturing for them to sit. The emergency department shifts, my mother said quietly. We've started them. And the community clinic hours. I pulled up their files on my tablet. I see. 3 nights in the ER, 2 afternoons at the free clinic. That's a start. It's enlightening, my father admitted. Last night we had a multiple trauma case. Gang shooting. I haven't handled anything like that in years. Welcome to real medicine, I said, remembering all the times they dismissed my ER stories. Where you don't get to choose your patients based on their bank accounts. We've been thinking, my mother leaned forward, about your original proposal. To join the family practice. Have you? I raised an eyebrow. And we were wrong, my father said simply. About you, about emergency medicine, about everything. The work you're doing here, it matters. All medical work matters, Dad. That's what I tried to tell you for years. I stood, walking to the window overlooking the emergency entrance. But this isn't about joining your practice anymore. What do you mean? Carter Family Practice will be absorbed into Metropolitan General's new community health initiative. I turned back to them. You can stay on as attending physicians working alongside the colleagues you once looked down on. Same salary as everyone else. Same rules. Same commitment to treating every patient who needs help. They exchanged glances, decades of privilege warring with the reality of their situation. And if we refuse? My mother asked quietly. Then you'll need to find another hospital. Good luck. Summit Healthcare Group owns most of the private facilities in the region now. My father nodded slowly. You planned this. All of it. The resident work, the investment firm, the acquisition. I learned from the best. I smiled slightly. You taught me about power and prestige. I just chose to use them to change the system instead of profiting from it. My phone buzzed, a trauma alert. Multiple casualties incoming. I need to get to the ER, I said, grabbing my white coat. The paperwork's on my desk if you want to stay on. Either way, Metropolitan General will keep serving everyone who needs care. That's non-negotiable. At the door I paused. Oh, and if you do stay? Those emergency department shifts aren't temporary. Every doctor here works them, including the chief of medicine. Especially the chief of medicine. As I headed to the trauma bay, I heard my father's voice. We'll sign. I smiled, hearing the approaching sirens. They'd finally learned what I'd known all along. That true medical excellence isn't measured in the wealth of your patients, but in the lives you save regardless of who they are.